Okay, well, thank you for having me, Bowie State Counseling Department. I'm really happy to be here. My name is Dr. Nyasha Grayman, and I am the owner of a boutique psychotherapy practice called Wisdom Counseling Baltimore. I'm also an associate professor of psychology at Goucher College in Baltimore County, and we're going to spend about an hour together talking about trauma informed cognitive behavioral therapy principles of practice. I'll talk for about 20 minutes, I believe, and then we'll have plenty of time for discussion. Okay. So, we have four objectives this evening. We want to cover a little bit of what we know about traumatic stress, the philosophical underpinnings of cognitive behavioral therapy, the principles and process of effective work with trauma using cognitive behavioral interventions. And then we'll wrap up with just a few examples of some interventions that I use. And while you're muted during this portion of the talk, if you have questions, put them in the chat and we will use those for discussion at the end. Okay. So we want to go over three things relating to traumatic stress this evening. One, what we know about how traumatic stress impacts the body. Also, what we know about how it impacts the brain and our mind. And also popular conceptualizations of what we mean by traumatic stress. So, traumatic stress, the impact on the body. Um, it typically impacts us one of four ways. Two ways involving activation, and two ways involving a shutting down. So, with respect to activation, that involves our blood moving to our muscles, getting ready to mobilize us. Our heart starts pumping, and the resulting act is either you're gearing up for a fight to fight off the threat or to flee the threat. Now, there are also two responses relating to shutting down. One relates to collapse, and that is when our muscles go limp, uh, we are frozen, and we are absolutely not in a position to fight. I see. Okay. We'll have the slides after. Then the second shutdown response is freeze. So freeze is interesting because when we're activated in response to a threat, our sympathetic nervous system is activated. And so that's what gets our blood going, the heart pumping. The parasympathetic nervous system is what kind of calms us down. And that's what's operating when we're in a collapse mode. Now, typically those act as seesaws. One is up and one is down, or the other is up and then the sympathetic is down. But in freeze, which is one of the shutdown responses, something unique happens. Both the sympathetic nervous system is activated and the parasympathetic nervous system is activated at the same time. And both freeze and collapse lead to a kind of frozen state, an immobilized state. But the difference between the two is that in a freeze state, your muscles are tense, the blood is pumping, but you're not able to mobilize. In a collapse state, the muscles are not mobilized and you're also not able to act. So, those are the four ways that traumatic stress impacts our body. And thinking about how it impacts our brain, we have four different types of memory: two types of explicit memory and two types of implicit memory. And under explicit memory, we have semantic memory, which is our memory for general knowledge and facts. We have episodic memory, which is our autobiographical memory for events, including the who, what, and where of an event. Under implicit memory, we have procedural memory, which is memory for tasks that we're able to carry out without really thinking about them. And also under implicit memory, we have emotional memory, which is the memory of the emotions connected with an experience. And traumatic stress will impact all forms of memory. With respect to episodic memory, oftentimes we have difficulty putting things in their proper order. The chronology is really challenging. Um, Making sure that you are keeping track of all the players can be very challenging. Procedural memory, an example of that might be, um, whereas you typically bring your mail into the house and put it on your kitchen countertop. And you can do that without thinking. It's just kind of something you always do. You bring in the mail, put it on the countertop. Under periods of traumatic stress, you may find yourself throwing your mail in the garbage or putting in the oven and then forgetting what you did with those items. And so when we think of traumatic stress, we're thinking about an experience that overwhelms our ability to regulate our emotions and to regulate our decision making. And so, one of the goals of working with traumatic stress is to increase the client's ability to tolerate the difficult emotions that are connected with it and to widen what we call window of tolerance. So, if you're hyper aroused in response to traumatic stress, and hyper arousal is connected with that fight flight response, then it's very difficult to regulate your emotions. If you're hypo aroused and you aren't able to mobilize your affect, it's difficult to be empowered and take care of yourself. And a common feature that you may have heard of relating to hypoarousal would be dissociation, where people feel like they're disconnected from their bodies. Okay. So, thinking about just some basic philosophical precepts that underline cognitive behavioral therapy. And trauma informed cognitive behavioral therapy is really important because I think traditional cognitive behavioral therapy actually does not operate in a way that's consistent with the needs of traumatic stress, given what we know about how traumatic stress impacts the body. So, from a cognitive behavioral perspective, suffering is the result of wrong thinking, our inability to see things as they are. So, cognitive distortions and cognitive biases cause us to suffer. Common distortions include overgeneralizing, catastrophizing, or personalizing situations that happen. And then, so from a cognitive behavioral perspective, healing is involved in being able to see things correctly, to confront our wrong thinking. And there are four basic steps to the cognitive behavioral intervention cycle.